Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department to give our weekly update on COVID-19. We continue to see good levels of drop that continue to happen in our cases, our hospitalizations, acute hospitalizations, fatalities. People are certainly doing much better as far as wearing their masks, socially distancing, spreading out, avoiding gatherings, those type of things. So we want to make sure we continue to do that, and we continue to see the vaccination levels increase in our community, across the state, and across the nation. So there's a lot of optimism of things continuing to move forward as more and more vaccines will be coming out onto the into the market. And again, we just follow the advice of our medical professionals who have done everything they can to keep us safe. Dr. Bogan is going to give the weekly update. We want to continue again. We're hopefully getting near the end within a few months of getting back to the normalcy that we all crave and we all want to have as we're approaching a year of the pandemic. So anyway, let me turn it over to Dr. Bogan. Dr. Bogan?
Thank you, County Executive. Good afternoon, and thank you for joining us. We had another week of reassuring case numbers. According to the state's early warning dashboard, the daily case counts dropped to 150 cases a day, and the positivity rate fell to 5.5%. There have been some small increases in daily case counts in the last couple of days, and we now have 3 confirmed cases of the UK variant in the county, leading me to continue to urge caution. Furthermore, today's warmer weather reminds me that spring is on its way, and along with it, longer days, outdoor activities, and a rejuvenating feeling. But as Allegheny County prepares to leave winter behind, I know there are plans in the works for events, gatherings, weddings, parties, get-togethers. And I want to remind you that events and gatherings, particularly indoor parties with people who didn't live together, precipitated the case surge in the late fall and winter, and our move to the green phase, along with the reopening of bars and restaurants and other businesses, led to the summer surge. We know that this virus spreads when people gather, and especially when they eat together, drink, sing, and shout. So as people start to plan gatherings, we want to make sure people meet safely to prevent the spread of the virus. So just a few reminders about do's and don'ts of event gatherings. We are still expected to follow the state's guidelines for events and gatherings. This includes some restrictions on food and drink and the state limits on how many people can gather indoors and outdoors. These limits are based on percentages of a space's maximum occupancy. And the details for all of that can be found on the Pennsylvania Department of Health website. You should keep at least 6 feet from others, and you must wear a mask at all indoor gatherings and at outdoor gatherings when you can't consistently keep your distance. Hand washing and hand sanitizing are also helpful. Finally, you shouldn't attend events or gatherings if you feel sick, if you've tested positive for COVID-19 and are in your isolation period, or you're a close contact of a case and you are in your quarantine period. I'm hopeful that we will see the end of this pandemic sometime this year. But for now, we must stay the course. Keep your distance from others, limit your trips out of the house, avoid large groups and crowds. We know this works, and for now, we need to keep at it. So on to vaccines. I'm going to start with some statistics about who the health department has vaccinated. These data are limited because the health department receives only about 10% of the vaccine distributed to Allegheny County. So the numbers I'm reporting only account for a small fraction of the vaccines given across the county. Since January 4th, when the health department started using the state's PrepMod registration system, the health department has given about 22,000 first doses of the Moderna vaccine. Nearly 75% of these first doses went to people 65 and older. Using self-identified gender, about 61% of those vaccinated are female, 39% are male. Using self-identified race, among those vaccinated by the health department, 77.9% are white, 15.3% black, 3.7% Asian, 1% other race, 0.3% American Indian or Alaskan Native, and 1.9% did not identify a race. Based on these data, the health department has vaccinated at rates consistent with demographic representation in the county. I wish I could provide that level of data for the entire county, but I don't have access to the data at this time. The health department, like vaccine providers across the county and state, has faced challenges stemming from the short supply of vaccine. Despite these challenges, the health department is confident it will provide all of its second doses within the CDC recommendation of 28 to 42 days for the Moderna vaccine. We expect to be able to reschedule all the second dose appointments that were delayed this week. Individuals who expected to receive their second doses from the health department this week should receive information about their new appointments by the end of the week. The health department will continue to offer second doses at its Monroeville vaccination clinic and will keep the Castle Shannon clinic running next week to provide first doses to those individuals 65 and older. More information on scheduling these appointments will be available by the end of the week. As the quantity of vaccine increases, the health department will continue to give first doses, open additional vaccination clinics, continue to work with community partners to conduct pop-up vaccination events, develop mobile services, and continue our work in subsidized senior facilities. As we approach the one-year anniversary of COVID-19 cases in our community, I've been reflecting on the vast impact the pandemic has had on our lives, our community, and the world. We've lost over 1,500 of our friends and family here in Allegheny County alone, and more than 500,000 in the United States. We have all been changed by the events of the past year. And like you, I'm looking forward to seeing family, friends, dining in, attending concerts, etc. But we are not quite there yet. So please remain vigilant and patient for a few more months. Meanwhile, please stay safe and be kind. Thank you for your attention.
The first question that we have is from KDKA Radio. Has there been any progress on vaccinating the senior citizens living in county housing authority buildings? Did last week's delay and shortages impact that program at all?
Yes, thank you for that question. Because of the uncertainty of supply, we did hold off on giving vaccines at senior facilities this week, but I'm happy to report that we gave about 140 vaccines last week at senior facilities, about 400 the week before, and we have more scheduled for the coming week.
This next question is from WPXI. Are you encouraged by the FDA endorsement of the Johnson & Johnson vaccine? How quickly could we see that here in Allegheny County? And let me mention we have similar questions from several other outlets as well.
Great. So as I mentioned last week, I am very excited about the Johnson & Johnson vaccine. To reminder, it's a single-dose vaccine, which is much easier for everybody. It is also requires standard refrigeration. And its effectiveness at preventing severe illness is very good, particularly its benefit of preventing hospitalizations and deaths. So yes, I'm very excited. I don't know the timing. The meeting of the FDA is at the end of the week. And I hope that within a couple of weeks we may see doses here, but I have no knowledge of that at this point.
This next question is from the Tribune Review. State officials yesterday said Pennsylvania is receiving its largest single-week allocation of both first doses and second doses of the vaccine. Has the health department seen an increase in its own allocation, and can you provide any specifics?
So again, it is a little bit more complicated because we do get first doses and second doses. This week is certainly better than last week. And as I mentioned, we are finding out information as soon as we have it, we give it out. But I don't have the specifics right now for all of the doses we're getting. So by the end of the week, I'll have better information to share.
This next question is from WTAE. Does the Allegheny County Health Department have any say or the ability to make any determinations about first doses or second doses? For example, the state gave you 7,000 doses this week, but also determined most of those doses will still be administered as first doses. Does the health department have to be at the mercy of the state?
In general, we have some flexibility, but in general, we really want to work closely with the state and work within their guidance as partners in this process, and that's what we have done.
This next question is from WESA. Has the county health department noticed demand for the vaccine decreasing at all now that more than 150,000 county residents have been vaccinated?
Absolutely not. We have, nearly 1 million people eligible for the vaccine in our county, if you think of those 16 and older, and we have not seen any decline in demand. People are ready and want it, and we're very excited by that demand for the vaccine in our community.
This next question is from the Tribune Review. Understanding there are often reporting lags when it comes to COVID deaths, can you explain why the county has consistently had data dumps, if you will, when there are several days of few to no deaths reported, followed by days with large totals from deaths that took place weeks ago? The state's death reporting does not appear to be experiencing the same lags.
I think I've addressed this a couple times in the past, but we get our data from the state electronic death reporting system, and they do a match system within death certificates about usually twice a week. And so when we get those reports, you'll have a large number of deaths reported all at once, and that's what has been happening, and that's why we see it sort of, but we also always report how many days that those deaths came over. So it looks like it's reported on one day and they relate to one day, but they really relate to a period of time. And again, we do provide that data when we give that reporting.
This next question is from WESA. Can you give an estimate as to how many vaccination appointments the county has had to cancel because people don't meet the age requirement?
I don't have that data handy, sorry.
This next question is from WTAE. Small independent pharmacies say they're getting the runaround on doses. Many have had to reschedule clinics and second doses for hundreds of doses as larger pharmacies do mass vaccination clinics with thousands of first doses. Has the county health department advocated for these small pharmacies at the state level? And what should these pharmacies tell their patients about how this process works?
The health department really understands the challenges these providers are facing. It is very challenging when you have things scheduled and have to cancel them. The state has guaranteed all of the vaccine providers in the state that they will be guaranteeing second doses. So that really is the state, and I'm just going to remind you, I don't have any control over the distribution of vaccine in the county. That is done at the state level. And so I asked them to talk to the state about that.
This next question is from WESA. Is the county health department still looking for volunteers to help with its clinics?
We really have had wonderful response for volunteers, and we can always use more. And so I remind you that we have something called the Medical Reserve Corps here. You go on to, if you type in Medical Reserve Corps into a search, put Allegheny County Medical Reserve Corps, it'll bring you to a website where you can sign up and go through a process to volunteer, and we would love more volunteers. So thank you for asking.
This next question is from WTAE. How are the plans coming along to find potential sites in the county for mass vaccinations once the supplies from the federal government become more robust?
We continue to look at sites, and we will let you know as soon as we have more information.
This one's a loaded question. Pittsburgh Business Times would like to know, what lessons have you taken from the last year of the pandemic, and what guides you moving forward in this next phase?
Wow, that's a hard question to answer on the fly. It has really, the pandemic has changed us all, and I think it's just important to look both internally and externally on the impact. I would love to sort of give that more thought. I spend a lot of time thinking about it, but I'm not quite ready to articulate my answer out to the world. So.
This next question comes from WESA. A vial of Moderna supposedly comes with 10 doses, and a Pfizer vial comes with 5. But sometimes providers can seek out extra doses, which might, eke out extra doses, which might go to waste because these doses were not anticipated. Has the county had to dispose of any vaccine doses, and what contingencies does the health department have in place to make sure this vaccine is used?
So no, we've not wasted doses. We, carefully plan based on the numbers of doses in the vials. We also are flexible. our Monroeville clinic is open late, and if we have vial doses that we might have left over at one site, we can bring them out to Monroeville. Again, they're good until they have to be used within 6 hours of puncturing the top of the vials. We're very careful at monitoring the time out. And so, no, we are very careful and conscientious about not wasting doses.
And this final question from the Pittsburgh Business Times. Can you tell us anything about how the virus is being transmitted now? If there are certain types of transmission patterns or outbreaks that we're seeing, if they're work-related, and what has been the impact of the vaccine so far on those?
So we don't have a good analysis of what's happening with the vaccine yet, and I know that that is an analysis we are all anxiously waiting to see. In terms of, I forgot the other part of the question.
Impact of vaccine.
Vaccine. So we don't know the impact of vaccine at this point. And the spread of the virus. So this has been the same for the last number of months. It's lots of things. It's still, it is not one place. It's a little bit of spread at a job. Occasionally it's spread through household contacts, which is a common one. But it's really a mixed experience of where the vaccine seems to be spreading. Again, some people don't know where they've gotten the vaccine, but there's no particular pattern to report like we did in early summer, where we had a clear pattern where people were telling us the same things. This is a very wide variety of experiences of where people are being exposed.
That was the final question.
Oh.
Thank you, Dr. Bogan, and looking forward to that answer of how we've all been changed as we think about that. There's no question, we all have, regardless of your position in life or whether you're with the health department, a medical facility, whatever you're doing, a school, whatever it is, we've all been certainly affected. Our families have, and as Dr. Bogan said, we've lost 1,500 of our fellow Allegheny Countyans and over 500,000 people in this country. So. There's no question the impact that it has had, including all of our operations. The one thing I will say is, standing here before you in December and January, we were in a pretty pessimistic time, seeing some of these numbers that were really not in a good place. And to see where we are now as we're heading into end of February, into March with more vaccines. So many of our senior centers, our nursing homes, our personal care homes, have been vaccinated. The residents of those places have been vaccinated, protecting the most vulnerable, which throughout this pandemic have been our seniors. And as Dr. Bogan said, the amount of volunteers is so, it makes you just feel good that there are so many people willing to help, willing to contribute, providing sites, providing people that are training to give the doses out and put them in people's arms. Also want to thank our friends at the United Way, handling the calls, the 211 calls that we've had, well over 600 this week. The times of the people who have to wait has been decreasing. They've been getting better and better at doing that. And as Dr. Bogan said, nothing's going to waste. If there's a few appointments that don't get filled at one of our senior facilities, it gets moved over to Monroeville or some other location. We're making sure we use them and get them into people's arms as quickly and as efficiently as we can. So, continue to follow the advice that Dr. Bogan and her team have been giving us for all these many months. We're getting hopefully towards a better place as we head into March and April and early spring and summer. And again, let's stay safe and do all the things that we need to do. Stay tuned. Optimism is feeling better. We're seeing a light at the end of the tunnel, and again, it seems